carrying this burden, because it is at the end of the day very very much connected, no, when our child, and also not just connected in terms of community, when our child is bullied or mentally harmed or etc., or the one, or our child is the one bullying, um the problem doesn't stop there. It also becomes like intergenerational, like what Dr. Hani would say. We have to nip it in the bud in terms of preventive measures. Of course, preventive measures would take, a bit longer to see the effects, but it is well worth it. So I see a lot of preventive measures happening also, especially in, yeah, from where I've had the opportunity of being exposed to. I hope this helps, Mr. Chair.
Thank you, Dr. Hannah. If you can narrow it down, let's say, to a an implementable program, no?
Mhm.
How do you?
Yeah.
What are the things that
Well,
we can implement right away, or
yeah.
things that we should implement in the next few years
I
to
think
address
all,
this?
yeah, I'm sorry. Yeah, sorry to harp on it. I think we call it by its name. Like, bullying is a problem. It's pervasive. It harms, quote unquote, our children. It harms our children. And when our children are harmed, of course, that will harm the community, the families as well. So I suppose maybe implementation in terms of a campaign, awareness campaign. We can have champions about anti-bullying, the awareness campaigns in terms of, we already know a law or an act in 2013. It's parang it's caught by that act, so it supports it. So when we have that campaign, the advocacy campaign, um, it's being implemented on a national level, perhaps. So everyone is on board, education, maybe PSWD, etc. So it's like a singular approach to it. So I think that could be very workable, very feasible. We can have that advocacy campaign on anti-bullying, and then because we have to also address the stigma. There's also stigma, and with the stigma is discrimination, right? Like what Senator Padilla said also, or shared in his lived experience of bullying, no? When people approach the channels, they will be taunted, they will be bullied some more, etc. So it's more of a mind shift, really. And this might seem small, but when done on a national level, it would truly be like the mind shift, sorry, will really carry the anti-bullying act home.
Yes. Thank you, Ma'am Hannah. I also saw someone raising their hands.
Yes, Senator. This is Dr. Bernadette Matthews.
Yes, Dr. Bernadette, go ahead. I sorry, I couldn't see the screen.
We have a program ready to go. It's the Safe Schools program. In fact, we are already starting it in Valenzuela. It's a program that is supported by both the Department of Education as well as the Department of Health. And the Department of Health also has a program on health promotion, which we want to put together with the Safe Schools program. So the meeting is being set. That Safe School program, the goals are to improve mental health outcomes, to decrease sexual violence, and with that goes the focus on teen pregnancy. You were also investigating the 10 to 14-year-olds with increasing teen pregnancy. And third, decrease bullying. So this program is targeting those three very urgent problems that your the Senate is investigating. And we have the evidence to say that these programs that we are promoting has already been tested and showed good results. So we now hope to implement it citywide and see whether that's all the things we're saying in terms of decreasing bullying, improving mental health outcomes, and also decreasing sexual violence, and with that, teen pregnancy. So it's ready to go. We're testing it, and we hope it could be scaled up to the rest of the country.
Remember, Dr. Bernadette, what are the features of this program? Can you give us just maybe three important features of the program?
Yes. So there's the teacher component and there is the student component. For the teacher component, we are, of course, which we started just last Saturday, is teaching the teachers on how to do mindfulness. Okay, because that has been shown to work also with increasing the coping mechanism of teachers with regard to stress, but they should know how to practice it before they can teach it to students. Once the teacher knows this, then we have modules that will be incorporated in health and in ESP, or the values curriculum of the students. So there are modules for grade 7 and modules for grade 8. For grade 7, the modules there is also the use of mindfulness, grade 7, and how to help your friends. We were talking about bystanders, etc. So that's in the health and in the values modules of grade 7. These are only 4 modules, 2 in health and 2 in values. And then for when they are grade 8, this is where the relationship modules comes in. You know, because when we talk about sexual violence, especially dating violence, you know, it's about how do you say no to peer pressure, you know, how do you deal with relationships with boys and girls, because boys and girls are different, you know, so, and how do you report abuse? So all of that is in this, also another 4 modules in grade 8. And we have tested these modules in Manila, Manila, and then one school, and the results have been really promising. So now what we're going to do in Valenzuela, and this is with Ateneo de Manila University Department of Psychology and Friendly Care. And so what we're going to do in Valenzuela is implement this now in all the public schools in Valenzuela. So we have just started the training for the teachers, and then we will be implementing the modules in the coming schools. Because the teachers first have to learn how to use it. So that's short of this one.
Thank you, Dr. Bernadette, and I'm so happy to hear that an expert like you is working with the city of Valenzuela and putting a lot of focus to education and to make it as holistic as possible to our parents. We have a running program there. It's called the Nanay Teacher Program because that's definitely what we also found out on the ground, that parents play a very big role in the education of their children, as well as in the growth and development of their children. And that fundamental principle, actually, to my surprise, sometimes is not as announced in the minds of our parents. So the intention there is to keep engaging our parents, keep on giving them knowledge in order to be good parents.
Yes, yes, I know. For the online teachers, the evidence-based parenting program. And the results also, the trial, the research done in Venezuela, had shown also excellent results in decreasing violence against children. And so these 2 programs, the Safe Schools and the parenting programs, we feel would really go a long way in decreasing violence against children, bullying in the age group DepEd was involved in the Safe Schools research, and the Department of Health is also very much interested to be working with DepEd on the Safe Schools for the mental health outcomes.
Thank you, Dr. Madrid. We call on Mr. Subong. I think his hands, Dr. Subong, Sir hands raised.
Thank you. Curriculum, it seems congested. Doon po, we could see that, I could see that students, my time po, so there is co-curricular and extracurricular activities. They are encouraged to play, they're encouraged to explore, which right now, it seems missing, even compared to my time, no? We have time for that. No? Another thing is, as part of the systems in place, is they have student support services.
Bij Essent krijgen we de laatste tijd veel vragen, zoals:
Hoe bespaar ik samen met mijn gezin?
kijk voor antwoord op deze en andere vragen op essent.nl/meer over vandaag.
So, I would like also to add, no, sa proposition ng ating resource person from the OCOPEA, no? Also for the protection of our teachers. And I hope na ma-discuss din po ito sa ating EDCOM, which kayo po nag-lead, to have these systems in place, because it's very important na hindi lang natin tingnan sa area of parents, but also sa area din ng nag-implement sa teachers, and even the systems within our education department. So I would like to share that information po. Maraming salamat.
Thank you, thank you. We also, Dr. Jan Levado, is raising her hands.
Yes, Senator, good afternoon, sir. So, just in addition to the inputs from Dr. Madrid, sir, the Department of Health, on top of the Healthy Learning Institutions program, we're also pilot testing the suicide prevention in schools. So basically, it's really about teaching and non-teaching cadre in the schools po for skills building pertaining to mental health. So we have interventions in the modules like self-care exercises, healthy responses, for example, interventions towards teaching and non-teaching staff, how to have difficult conversations with students, how to communicate verbal and non-verbal communications, feedback, and suicide communication and safety planning, we also added in the modules po, knowing your Generation Z. So parang it's really about teaching our, DepEd personnel how to recognize all these things pertaining to mental health. So we're currently pilot testing it, sir. So we started with the Cordillera Administrative Region's DepEd personnel. We're hoping that we can also pilot it out in other regions. So we're already done with that. The second intervention po that we're currently also doing right now is that together with the USAID, we have developed the Lusog Isip app. It's actually parang a self-screening for mental health conditions. So there are a lot of parang apps right now. I think this is the first app in the Philippines for mental health screening. So you can just visit the app and you can screen, you can check the questions and screen if you're really at risk for mental health problems. Siguro sir, the third and last perspective perhaps that we can put into this conversation is that I think it's also high time for us to consider that for the kids that are bullied, we should also see the profile of the student. So for example, perhaps may mga estudyante po talaga yun na may learning disability, for example, or autism that is really unapparent. So in the Department of Education, ang na-enroll lang talaga sa special education are those with apparent disabilities. And we know that in the Philippines, around more than 150,000 or 160,000 Filipinos have autism and 10% lang talaga yung diagnosed. So this is also, I think, one part that we should look into. Baka naman yung mga bata that we're seeing has actual learning disabilities that we can't recognize or the teachers can't recognize as well. So that's it, Mr. Chair. Thank you po.
Thank you, Dr. Levado. I just want to share with everyone. No, we were doing our research, and UNESCO conducted this international conference on school bullying. I think this was in partnership with the Ministry of Education in France, and just goes to show how bullying is an international issue. No? It's not confined to the Philippines. It's not confined to one school. It's not confined to one barangay, but it's an international phenomenon. No? And this is actually this actually goes to show, no, that bullying is a serious matter that we need to address. No? And even though these countries have already addressed bullying in their own respective jurisdiction, as evidenced by the low prevalence, they still meet up. No? And if you read this article, it's not only practitioners in the medical field, but scientists who study statistics and data. And in page 3, they itemized here the 9 components of the whole education approach to prevent and address bullying and cyberbullying. And they call it whole education approach because based on their study and evidence, that it should be addressed on a system level, you know, meaning the whole schools, the whole education system should address bullying and cyberbullying. So, and if you see the components, in fact, the components are the things that we are discussing today, you know, exactly what we are discussing today. But of course, the key here is implementation. No? At the end of the day, is how you implement. But one of the items here that I want to emphasize, it's the bottom left, no, yung may mata. Evidence monitoring of school bullying and evaluation responses. Basically, this is gathering data, and this is what we lack. Right now, we don't know. We're blind in terms of bullying. The survey is saying 40 to 65%, but on the ground, we're blind. No? We don't know if we are addressing bullying. First, we don't know how many talaga, no? How many are really being bullied at the school level, um, how many students are experiencing bullying, and then how are we responding, and if our response is effective or not. No? We don't have that data to study. No? And that leads me to some of my takeaways today, that bullying is also part of mental health. No? And we extensively discussed that last week. And when we all know that we have a some shortages when it comes to mental health. For example, shortage in talent, shortage in program, and we're addressing that through that law. Another takeaway today: parent engagement is also very important, no? And that's why we have that law, the Parent Effectiveness Service Law, no? That is not being rolled out completely. We also need to make sure that the hotline and avenues to connect to government is also pronounced. Apparently, it's not as popular as we want, no? And that's why there's massive underreporting. And the other one I got from Dr. Madrid, that there are existing programs that we can already use, no? And I urge DepEd to look at that. These are evidence-based programs being implemented by the private sector. Let's just scale it up. Not reinvent the wheel. Dr. Madrid is a Magsaysay awardee, you know, and her programs are not just off the shelf programs. These are well designed, well researched programs. And my takeaway here is, let's not reinvent the wheel. Let's pick on the low hanging fruit so we can address this bullying right away. So those are my key takeaways today, but just goes to show. Now, I just want to point out that bullying is an international phenomenon that needs to be addressed. No? And if ulitin ko lang itong slide ng PISA because na-shock ako dito. No? And, ito. No, that Philippines is the number one among 70 plus countries in terms of bullying, and it's something that is really bothering me ever since I saw this slide. No, um, let's study what Korea is doing. No, let's study what Chinese Taipei is doing. These are Asian countries. They must be doing something correct, or they're probably implementing something that we are not implementing. No? Nasa ano tayo, nasa pinakadulo tayo ng spectrum eh. No? So this is a challenge to all of us. No? Part of the recommendation nga in that international is strong political leadership. We provide that, but we need to address this incidents of bullying in our country. No? And that's why this is the my call on DepEd is to submit to us your recommendations on how to improve, how to update the law. We're discussing the mental health law last week. We will already move into we're already in the technical working group. But we still need more analysis from DepEd and more recommendations. No? Either recommendations to improve the existing anti-bullying law or recommendations to further improve the mental health law that we are talking about to address bullying. So, because you guys are the ones implementing it on the ground, we need feedback from you on how to improve this. And of course, from our other stakeholders, if you have other recommendations how to improve the law, feel free to send it to us through a position paper because we need to address this. This is, for me, an unacceptable phenomena that we are number one, no, in the whole world in terms of bullying. No? And people think that if you ask tourists, ang bait-bait ng mga Pinoy, that we're known for being friendly, we're known for being caring, we are known for being open to tourists because we can speak English and we have that very caring manner, but we're not caring enough for our children. We're not doing enough for our children. Our schools are unsafe, our children feel unsafe, and we need to do more. Hopefully in the next round of PISA, this will not be the same slide. No? So, any last words from our stakeholders, from DepEd? We have already exhausted almost all of the issues surrounding bullying. What we will do is we will review the data today, review the takeaways. We'll recommend on our own what to improve in the anti-bullying law, and we will make sure that this is related to the mental health law that we are discussing, so it will be harmonious. But we welcome your suggestions, especially from our panel of experts. Yes, to Mr. Banes of Seneo.
Mr. Just quickly on at the regional level, we would encourage the department to take a look at our neighbors, especially in Vietnam, because in all metrics, the standards that we are looking at, they're really performing above and beyond the region. Especially in terms of bullying, they've performed better in all engagements, especially on parental engagement. One practice that Vietnam is doing right now is teaching parents non-violent communication and discipline, which is one thing that was already brought out during our discussion. Also, Vietnam is doing or is championing digital literacy, incorporated into that framework the idea that children should be aware in using social media properly and ethically. So Vietnam is really on board in terms of digital transformation in the region, and I hope that other countries like the Philippines can also copy and model those kinds of practices and strategies. So we at Sineo, we will be doing the CPLM in the second round of assessment next year. And the 2019 metric is from the pre-pandemic context. So we will take a look at the impact of COVID-19 pandemic next year. So hopefully we can get back to the committee and report again what the data tells us.
Thank you for Sumeo, and thank you to Secretary Briones for her willingness to share with us your research and your data and also your findings, especially looking at it from a regional lens. No? So thank you very much for that. So I don't hear anyone who is interested in sharing their thoughts anymore, unless there are any more comments or any more suggestions. If not, please submit to us your position paper on this matter. We really need to address this ESG. I'm very happy to hear Dr. Madrid has been rolling out programs that are geared towards making our schools safe, empowering our teachers and our students, and these are the low-hanging fruits that we can tap into. And that's why I tell that let's not look so far. There are people who have already done their homework in terms of addressing bullying. So let's look at that. But we're the next step on this is to come up with a list of recommendations and a list of items that we can improve on the law. Take into consideration that there is a mental health law that's being discussed, and there's a parent effectiveness service law that is being implemented. So we're all going to make it harmonious. So with that, again, thank you very much for your time. Thank you to our experts who joined us today, and wait your position paper on the matter. Maraming salamat po. This hearing is hereby adjourned.
Als jij je de laatste tijd regelmatig afvraagt hoe je vaste lasten überhaupt moet gaan betalen, dan is deze video voor jou. Want alles de laatste tijd